Good afternoon, everyone. This is our special meeting with Heritage Health. It is March 28th, 2023. The time is 3 o'clock. I am calling this meeting to order. In attendance are Commissioners Brooks, Matari, and Duncan. Are there changes to the agenda? And
Nope.
Hearing none. All right, our item is the fiscal year 24 Heritage Health budget request with our Chief Executive Officer, Mike Baker. If you want to come to a table and go ahead and just hit the button, and you can leave the microphone right there. Welcome.
Thank you. Do you want me to just do kind of our general overview? Is that
Sure, since for Commissioner Matari's new.
Yeah, no, that sounds great. So I'm Mike Baker with Heritage Health. It's been an honor working with you guys over the last, I've been here 13 years, and we've always had some level of involvement, between our organization and really the main interface around the patient, the Indigent Care Fund. I think that's where the relationship with the funding started. Was back, before the Medicaid expansion had taken off. There really was this discussion about how do we efficiently take care of patients when they have these acute needs. As you all know, the Indigent Care Fund was one of those places where folks they'd have a problem, they'd end up coming back in seeking help to get coverage for some of the healthcare problems they had. And what we saw at the time was that, I'll say inappropriate, I don't mean it in a bad way, but just inappropriate use of the emergency department. So coming in, using the emergency department for things that probably should have been better dealt with inside of a primary care realm. The emergency department is a fantastic place to go when you have you cut your arm off. Please don't come see us. That is not our specialty. Right. If you have a cold, a cough, runny nose, you need your diabetes managed, those types of things, like that's the stuff that really you need to pull out of the emergency department so that those providers can focus on heart attack, stroke, car accidents, all that stuff that's really important. But also looking at just the cost of delivering, a strep throat test inside the emergency department it's a very different cost structure. And so that was the problem we were trying to solve, was how do we work with the Indigent Care Fund to make sure that patients had better access to primary care services. And so that's really where the funding from the county helped us cover that. And at the time, we had about 70% of our patients, when I started, were uninsured. This was a significant challenge in the community. Just how do you keep an organization sustainable, with that level of uninsured patients? And so we had to really figure it out. And so our organization worked really hard over the last, 13 years I've been here, but we've worked really hard to kind of balance out that payer mix, and recognizing that patients with Medicaid or Medicare, they also have a hard time accessing the healthcare system. But for us, at least, it's somebody that we could bill for those services as well. And so it helped us balance out our financial structure. And as we saw that balance, we really were able to get to a spot where we could increase access for our community. You'll see our growth trajectory over the last several years. It's been pretty incredible to look and see where we are today versus where we were about 13 years ago, and even back at the very start. We started out as a volunteer clinic, 2 nights a week, patients just lining up around the clinic, and looking at the spirit and passion that Lidwin Durney and the volunteers had when they started this organization. We just finished a retreat with the board of directors and kind of looked at the history of the organization over that time, and I think they'd be proud of us. I think the founders will be really proud of the work that we've done. We have seen significant growth, obviously, in our community over the last several years. We're looking just at overall healthcare infrastructure. We all know that there's significant challenges there, and we're feeling that. We lost a bunch of staff. The COVID years were not great on anybody, but we've been very fortunate to where we've been able to staff back up, and we're actually kind of in a spot where we've put some hiring on hold because we're running out of space to put them again, and that's a problem we've always had. But when we were restaffing, it took us a little bit to get there. So we're in a really good position. When I look at the allocation from the county to Heritage Health for our uninsured patients, we still have uninsured patients in our community. We're running about 8%, I think, of our patients are uninsured. We take care of about 30,000 patients a year. The last couple of years have been a little bit lower than that, and that really, when you don't have staff to take care of patients, your numbers drop. But we see that, that 30,000 is really kind of the target of what we can serve at our current level. And so, we certainly have, 1,500 to 2,500 uninsured patients that we're taking care of. Those patients come in, they pay it. Everything's on a sliding fee scale. Generally, it's about $25 for an office visit. And then we have a separate fund called the Mary Ellen Fund that we use to provide scholarships for patients that just truly don't have the financial means to meet their copays to deliver services. And so we look at, take somebody that needs therapy. Therapy, you are generally seen once a week for kind of an extended period of time, depending on how it goes. Even at $25 a week, that adds up a lot. And so our scholarship funding really goes directly toward the patients that need to help cover those copays. When we look at patients with dental, dental treatment is just expensive. It's an expensive service for us to purchase the supplies, to deliver, even on our uninsured sliding fee scale. There just are fees that we incur that it's just hard for patients to get there. And so, part of the community health center mantra really, like the patient has responsibility in their care. They need to participate, but we also don't want it to be such a barrier that patients aren't getting the care that they need. And so that's where we fall back on this. We call it the Mary Ellen Scholarship Fund. So the money that we receive from the county goes right into that Mary Ellen Scholarship Fund. So we can show you, how the funds are being used. It doesn't fall into our marketing budget or doesn't pay salaries for staff. It just goes right into, this particular bucket so that we have funding to take care of patients that truly need it the most. We sustain the organization off of all of our other things, out there, but that's how funding from the county has always been utilized. And it's always been good. I feel that's the purpose, right? The funding is supposed to go directly to take care of patients. We can match it up. We can show you, here's how the funding's utilized, and this is what it does. We never want to be a burden, as you guys are considering your funding. Obviously, it helps us meet our mission. We love the partnership with the county, but we don't want to be a burden. We recognize that budgets are a challenge, and at the end of the day, this isn't going to have us close our doors. If this funding isn't there, we'll find another revenue source. We're not going to stop, but we're not looking for any drama as we put this together. We're here. We are gonna continue to meet the needs of the community, and we love the partnership. We think it makes sense. It's really cool for us as we talk to other health centers across the state to talk about this partnership that we have with the county, that the county is investing dollars in helping patients, get the care that they need. I think that's very unique. It's something that our community has always seemed to support and be excited about. The last couple of years have been challenging in the sort of the community dialogue, but we're here for everybody. We're gonna have a heartbeat, and you want health care. We don't really care about all the other stuff that's happening there. We're like Switzerland. Just show up, we'll patch you up, we'll get you fixed up, and everyone can go fight about whatever they want, but at least they're healthy while they're doing it. So anyway, it's been a real honor, and we love being here. We're excited about the next 10 years. Our board's mapped out a pretty aggressive and exciting growth plan for us, and we're looking at all of the services that our community needs, and we're looking to continue to be a big part of that. So with that, if you have any questions or anything we can answer, I'm happy to do it.
Bill, questions?
No.
No. Okay. Bruce?
I was just curious on the, you mentioned 8% of your patients are uninsured. Do you have to treat them? Is that similar to like emergency rooms where when someone shows up?
So yes, now it is different. So the emergency room has the mandate, the EMTALA mandate that's there. Ours is tied to our grant funding. So yes, we have to take them. They're certainly, it's not as strict as the emergency department requirements. So, if somebody comes in and they threaten to shoot our providers, then we don't have to take care of that. But we're really trying to find that balance where EMTALA just has a lot stricter interpretation.
So it's grants that dictate it, not statute.
No, yeah, it's Section 330 of the federal government under the Bureau of Primary Health Care, but that's where the rules that apply to community health centers
Okay.
hit. And in those standards, it talks about the care for the uninsured.
Okay.
Go ahead.
How much are you asking for?
So our request is always, it's kind of varied depending on where the county's been. I think, we've been in that $50,000 range the last couple of years. I guess we don't have a specific request. We don't want to be a burden. I can use $50,000, we can use $300,000, we can survive on whatever makes sense on your end. Again, we don't want to be a burden on the county budget.
No, I understand. I appreciate that. I'd mentioned before, I think with the Jobs Plus program that, this is my first time going through the budget
Sure.
season. So in some respects, kind of surprised that we're having discussions with discretionary funds before discussions with, state mandated requirements.
Sure.
And so I know the big thing for me is just making sure that we don't end up like the cobbler with its kids, where we don't, take care of the folks that, we, by law, we have to, provide those services. And then after we know that that's been taken care of, then the discussion for discretionary funds could be had.
Yeah, sure. And again, that's your process. Whatever y'all need to do,
Yeah.
we're here to serve. We want to take care of our community.
Yeah.
And, if you guys have room and this makes sense for you all, that's great. It will help us a bunch, but not my process.
It's clear that you definitely want to help, folks on their medical needs. So,
And just to speak to a little bit, this is the season of presentation. So our people don't get their budget stuff together, and this is why we hear from
Yeah.
our partners first.
I understand.
Yeah. So anyway, nothing else? Nothing else? Anything else?
No,
Okay.
no. Thank you for coming.
Yeah,
on.
thank you for your time.
Yeah, appreciate it. And then just public comment. So
There's this button.
yeah, you can do that. Okay.
Commissioners, hi. I'm going to sound like a broken record, I'm afraid. I just don't see how it's the proper role of government to be charitable with taxpayers' money. If you have a surplus rainy day fund for the lean years would be a great idea, or returning it to the taxpayers would be even a better idea. Obviously, Heritage Health provides a great service to the community, but they operate in a nonprofit status, and it doesn't need taxpayer funds to carry out their mission. From what I heard from the presentation, funds are stuck into where they do indigent, cover costs for indigents. And I don't know if they're synonymous, if they're making that synonymous with uninsured, but I happen to be uninsured and I've never been indigent in my life. Pay my bills, get great health care. So I just want to put that out there in case those are getting mixed together. But one of the things particularly about the ask from this nonprofit was when I found it quite offensive to see what they promoted and sponsored with their dollars. So their budget has priorities that don't align with a lot of the community taxpayers. They funded an event last summer that really set the community on edge. And a lot of businesses, I believe, got pushback from that. And I haven't seen as many sponsoring of that going on again this year. We don't know. It might roll out later. We might see more. But it indirectly links the county to whatever these organizations participate in when we fund any portion of their budget. And so it was disheartening to see that on multiple government levels for this particular event that I'm speaking to. Anyways, like broken record, fund the county offices, I implore you. We're looking at lean economic times, and let the private sector do the private sector stuff. So thank you for your time today.
Thank you.
Thank you.
Anyone else? Anyone on the line, Jonathan? Anyone on the phone line? All right, 3:14 p.m. meeting adjourned. Thank you all.
Thank you.